Hi, my name is Caitlin Sweeney, and I am a physical therapist and certified lymphedema therapist with specialty training in oncology rehabilitation. Continuing our discussion about lymphedema in the breast cancer patient population, I would now like to speak a little bit about treatment for lymphedema. In physical therapy, I do what's called complete decongestive therapy, or CDT, to address lymphedema. This is a 5-component approach to treatment to reduce the symptoms of lymphedema and improve patients' function and quality of life. One component of treatment is called manual lymphatic drainage, or MLD. This is a massage technique for the lymphatic system which moves the lymphatic fluid more than it usually does. MLD increases lymph angioactivity and reabsorption of protein-rich fluid. It promotes relaxation while creating an analgesic effect. Patients generally find this massage to be very comfortable and often report immediate improvement in symptoms afterward. Another component of treatment in lymphedema is compression. The type of compression used on a patient varies from one individual to the next, depending on a variety of factors. Applying compression to the swollen region helps to reduce the filtration rate and improves the efficiency of muscle and joint pumps. It also prevents the reaccumulation of the evacuated edema fluid. It can additionally break down deposits of indurated or hardened tissue and help the skin to get a little bit softer and move a little bit better in more progressed cases of lymphedema. The next component of treatment is exercise. Exercise is very beneficial for the lymphatic system because it increases the muscle and joint pumps in our bodies to help move the lymphatic fluid and get it to be processed better by the healthy areas of the lymphatic system. Exercise is even more beneficial when it's performed while wearing a compression garment because then you're additionally getting compression to help move that fluid out of that congested area. Skin and nail care is the next component of treatment for lymphedema. When you have lymphedema, you are at an increased risk for infection in that region due to the accumulation of lymphatic fluid. When you have swelling, especially swelling that is specifically due to increased protein-rich fluid, which is the case with lymphedema, bacteria is drawn to that area. So patients need to take good care of their skin to prevent infection and skin breakdown. Patients need to be diligent about applying lotion to avoid excessive skin dryness, avoid injuries such as cuts, bites, and burns, and if an injury does occur, the lesion needs to be cleaned immediately and protected and then monitored closely. If an infection is suspected, it's important to contact your healthcare provider immediately so that it can be treated and addressed. The final component of complete decongestive therapy is education for the patient regarding self-care and home management. Unfortunately, lymphedema is a chronic long-term condition once it's developed. As a result, it's very important for patients to put in some effort to manage their lymphedema and be well-versed in how to take care of themselves so that lymphedema doesn't have to significantly impact your life and your function. Management includes, but is not limited to, having good skincare, as we just discussed, taking care to prevent infection, as we just discussed, knowing how to put on and take off compression garments and how they should fit, how often you should wear them, how they should be utilized. Also, what exercises to do, what's beneficial in terms of movement and exercise for that specific patient, and how to perform self-massage. The manual lymphatic drainage massage technique that we discussed can be done independently with self-massage. So it's important that patients with lymphedema regularly follow up with their doctor and physical therapist to monitor their lymphedema over time. That way we can help to identify how things are going, if anything needs to be adjusted. For example, if a new compression garment is needed or a new exercise program, or if maybe some more frequent massage is needed, or maybe less frequent depending on how it's going. So I hope this helped you to understand a little bit more about lymphedema and treatment of lymphedema.